Hello guys, my name is Elvira, NPM 8056. I want to tell you about early detection of cervical cancer with pap smear. Check it out. First, we have to know what cancer is. What is cervical cancer? The cervical or cervix is the part that connects the uterus and vagina. Cervical cancer is malignancy that occurs in the cervix associated with the human papillovirus. Who is at risk of become infected? First, young age who have sex. Cervical cancer tends to rise when having active sex at the age before 17 years. Because at this age, cervical mucosal cells are not yet mature, so they are prone to turn into cancer cells. 2. Smoker. And 3. Changing sexual partner. What are the signs and symptoms to look out for? First, experiencing bleeding outside of, menstruation during or after sex. 2. Experiencing bleeding of discharge after menopause. 3. False smelling discharge for the vagina. 4. Experiencing pain in the pelvis. 5. Feeling pain during sex. 6. Feeling sick when defecating or bladder. How do you detect cervical cancer early? By way of pap smear. Pap smear is method of examining cells taken from the cervix and then examined under a microscope. Pap smear is a safe and is inexpensive test and has been used for many years to detect abnormalities that occurs in cervical cell. What the benefit of pap smear? First, early diagnosis of malignancy. 2. Follow-up care after surgery and after receiving chemotherapy and radiation from malignancies. 3. Determine the inflammatory process. Who are recommended for pap smear? Okay, ladies are recommended pap smear only for first have been married or sexually active for the first 3 years and or before the age of 21. 2. Have a history of repeat sexual diseases, check-ups every 6 months. 3. Women who start sexual relation when they are before 18 years of age. Woman age after 30 years with normal pap smear, test result 3 times, retest every 2 or 3 years. And woman white hair rise such as HIV infection or weak immunity should have tested every year. And then woman who had a simple hysterectomy. Okay, next, inspection instruction pap smear. First, do not doing this during menstruation. 2. The best time is 10 or 20 days after the first day of the last menstruation. 3. 2 days before the examination. Do not wash the vagina or use vaginal medication. And 4. 1 or 2 days before examination, sexual intercourse is prohibited. Okay, thank you for your attention. Remember, the early the cancer cells are detected, the lower risk of developing cervical cancer. Goodbye, see you.